Welcome students. In the series of anatomy of excretory system, we have already seen anatomy of kidney, ureter, and now we come to the bladder. ठीक है? So what is bladder? Urinary bladder. Bladder हमने पहले कहाँ सुना होगा और कहीं आप लोगों ने? बॉल में, फुटबॉल में जब हवा भरवाने गए होंगे तो उसके अंदर ब्लैडर रहता है. जो एक्सटर्नल पोर्शन है फुटबॉल का, दैट्स डिफरेंट विद व्हाट यू सी. बट हवा कहाँ भरते हैं? अंदर ब्लैडर में. जस्ट लाइक इन साइकिल, टायर के अंदर ट्यूब रहता है, दैट इज द ब्लैडर. सो हियर ऑल्सो द ब्लैडर इज यूरिनरी ब्लैडर. यूरिनरी ब्लैडर का मेन काम क्या होगा? जस्ट लाइक in all other examples that I have just given you, it's a reservoir of urine. Urine कहाँ बन रहा है? Excretory organ is kidney. Kidney में urine बना and then after that it is collected by the collecting tubules, sent to the minor calyces. Minor calyces join to form the major calyces. Major calyces join to form the pelvis of kidney. Then ureters, right and left ureter from right and left kidney. Both the ureters are going to open, or you can say they are opening to drain the urine they have collected in the urinary bladder. And urinary bladder, when it is full, it will drain out the urine through urethra. So first of all, when do we say that it is ready to drain? The capacity is approximately, you can say, 120 to 320 ml of urine. तो इसका बीच पोर्शन ले लेते हैं, that means 220 ml. 220 ml is the average capacity of urinary bladder, but it can still retain up to 500 ml of urine. But after that, still if the urine is retained, then it will cause pain. Where? In the lower part of abdomen, in the perineum. But in some conditions, when there is atonic bladder or there is obstruction to the outlet of bladder, that means where it is opening in the urethra, if there is some obstruction due to prostate enlargement, obstruction due to stone, renal calculi, or innervation problem, so that's called atonic bladder. So any reason can be there because of which there can be excessive retention of urine. We call that condition retention of urine. In that condition, the urinary bladder can expand even up to the umbilicus. Normally, कहाँ रहता है ये bladder? It's in the pelvis, but not in children. In infants, it is present above the pelvis because the pelvic cavity is very narrow in infants. But as the child grows, the bladder descends down in the pelvis. So here you can see this is pubic symphysis. Means the pubic bones from both the sides of the hip bone, they join together in the midline in anteriorly, right? And that portion is called pubic symphysis. Just behind the pubic symphysis, you can see this triangular structure. This is bladder. This is a section. That is why you will see it as a triangle. But normally the shape when the bladder is empty is tetrahedral. Tetrahedral shape. So what are going to be the features? आपने tetrahedral इससे पहले कहाँ सुना है? Geometry में. So tetrahedral shape में इसमें क्या क्या present है? See. One is apex, and when we talk about apex, there has to be base. So this is the base. Apex, base. Then borders, okay? Borders are 3. This is the section, but if you just expand it, it is like this, okay? Like this. One border will be here, one border will be here. And because this is the anterior end and this is the posterior part of it, so both are going to be lateral because apex is lying in the midline. So one is right lateral border, one is left lateral border. Both are lateral. Right lateral, left lateral. And one will be here posteriorly, right? because this is the base. Something has to separate, isn't it, from the superior surface. So that border is called the superior border. So there are apex, there is base, there are three borders. So surface will also be three. In here we are not calling base any surface, okay? Three surfaces. One is the superior surface, that means between both the right and left lateral border, the surfaces with whatever is superior is called superior surface. And then we will have two surfaces like this coming down from the right and left lateral borders, it going towards the here neck. This is the neck of bladder. So when they go down, one is called the right, one is left latero-inferior surface. So these are the surfaces, right and left, but latero-inferior surfaces. So all finally converge here to the neck of bladder. So this was the shape, this was the boundaries and surfaces of bladder. But if the bladder is full, now this apex of bladder will not be directed towards the pubic symphysis then it will be directed towards the umbilicus. Umbilicus is over here. It will be directed towards the umbilicus, and then all the borders that we have talked about, right lateral, left lateral, posterior, superior border, base, all are going to be obliterated. Now it will become like this, oblong, ovoid in shape. So it will only have an anterior surface and a posterior surface, that's it. And posterior surface is already, we have said, it is not a surface, we call it a base, right? So all the distinction will be lost when it is full, and it will go on losing its boundaries as it becomes more full. जैसे मैंने कहा कि उसका capacity 120 ml to 320 ml, but after 500 ml it is excessively enlarged and it is reaching upwards up to the umbilicus. It can grow there, okay? So this was about the shape of empty bladder and shape of full bladder. So empty bladder is tetrahedral in shape, full bladder is nothing but ovoid in shape, okay? So this thing you must have seen. Now just follow this line. This is peritoneum, okay? Peritoneum coming like this. So peritoneum is covering the superior surface of bladder, but it is not covering this surface or the posterior surface. Clear? So the peritoneum is covering the bladder only on its superior surface, and then it is again reflected back. Now this is a section of a female pelvis. In female pelvis, you have got this uterus folded over the superior surface of bladder. Then this is the cervix, this is vagina. So this portion of cervix and the upper portion of vagina, they are related to the superior surface of bladder. And between these two, this peritoneum is reflected back and covering the anterior or inferior surface, you can say, of the uterus. Then this is the fundus of uterus, this is superior or posterior surface of uterus, and again going down between rectum and uterus and again reflected back like this. Then it is covering the loops of intestine like this. See, this is mesentery, which is containing so many loops of ileum, jejunum that we have already seen in GIT. So you know the position, the place where it is situated, okay? You know the normal capacity of bladder, you know the shape of the bladder, you know the boundaries, you know the surface. Now, there is a difference between the relations of bladder when it is in female body or in a male body. How that I have just shown you. Here it is related to uterus, cervix and upper part of vagina. And this fold between the uterus and superior surface of bladder, it is between bladder and uterus. Anything which is filled with any liquid is also called vesicle. So we call it utero-vesical pouch. Pouch means like a purse, a pouch. So this is uterus, this is bladder, which we are calling vesicle. So this is utero-vesical pouch. And in female body, the same fold of peritoneum which is going down and again forming a pouch here between rectum and uterus. It is called what? It is between rectum and uterus. So here it will be called pouch of Douglas. Whereas if it was a pelvis of male, after the bladder we would have had rectum. In that case, this pouch would be called recto-vesical pouch. So the fold of peritoneum between bladder and rectum in males is called recto-vesical pouch. But in females we have got two pouches. One is between uterus and the bladder, and so that is called utero-vesical pouch. One is between uterus and rectum, so we call it pouch of Douglas. Okay, so another difference is, if it is now this female, about the female you have seen, if it was a male pelvis, what are the other things which will be present which are not present here? The posterior surface here, it will be related to prostate gland, it will be related to seminal vesicles, vas deferens. So vas deferens will penetrate the prostate gland and then it will open in the urethra there. So that after that it is called seminal vesicles are also going to open in it through seminal ducts. And after that, that portion of urethra is called vas deferens, sorry, not urethra. The vas deferens between the opening of seminal vesical duct and where it opens in the urethra. This portion of vas deferens is called now ejaculatory duct. So this portion in the neck of bladder, it is also surrounded by the prostate gland in males. Prostate glands which has got lobes and it is surrounding it all around. So there it is also one more duct which is opening in that urethra, and that duct is called ejaculatory duct. It is nothing but the vas deferens after it has been joined by the seminal vesical duct. Okay, so here the ejaculatory duct will also open around in this urethra in the neck of bladder. Now you know that vas deferens is carrying nothing but the sperms as well as seminal fluids, and also having the fluids or the secretions of prostate gland, which is called prostatic fluid. So that has a different function, and the bladder has a different function. Bladder is having urine, so it has to pass in the urine, so that is only a part of excretory system. But ejaculatory duct, when it opens here, it doesn't need the urine also to go down. So now here there is a difference of innervation because the function is double here, not in the females. The muscle of the bladder is called detrusor muscle. It is a whorl-like muscle, okay? It is whorl-like irregular muscle. It contracts like this. It contracts in totality. It is not like peristaltic movement that one portion will contract, after that the second will contract, after that third. It will contract together. So here now, this detrusor muscle, it is going to contract. And for that contraction, we need parasympathetic innervation. So detrusor muscle is going to contract, that means urination is going to happen by that. But this preprostatic urethra means the urethra just before the seminal vesicle, prostatic fluid, they are all draining their secretion along with the sperms through the ejaculatory duct there. That portion is called preprostatic urethra. It also has a sphincter there. That sphincter is supplied by sympathetic nerve. Sympathetic is adrenergic in nature, okay? The neurotransmitter is adrenaline, but the parasympathetic is having neurotransmitter as acetylcholine. So they are called cholinergic nerves, and the sympathetic are called adrenergic nerves. So this preprostatic portion of urethra in males, it is supplied by sympathetic nerves, whereas detrusor muscles, they are supplied by pudendal nerve and parasympathetic nerves, which will contract only to drain out the urine. So this is a slight difference in the innervation. Now we have to see the inner portion. What about the inner portion? In the empty bladder, if you open it, you will see a lot of folds. You can see folds over here. They are called rugae. A lot of folds. But when you see the base of bladder has a smooth triangular area. Triangle with base upwards and apex directed downwards. Apex has the urethric opening. Okay, urethra is opening from there. And the base has two ends, right and left. Both will have the opening of ureters, the right ureter and the left ureter. So together, this base, this triangular area, the smooth area is called trigone, where the apex is having the urethral opening and the base is having two openings, ureteric opening of ureters coming from each right and left kidney. Clear? Now we come to the urethra. Urethra, as you know, the function is different. In females it is just 4 centimeter long, while in males it is 18 to 20 centimeters long. Now we talk about the ligaments, how this is being held there. Now the true ligaments are there, false ligaments are there. True ligaments, see, it's very simple. One has to be right here in the midline anteriorly. So that will be called median ligament. And median ligament is nothing but a fold formed in the posterior surface of anterior abdominal wall, and that was formed by this. You can see these two red lines here. This was urachus in the embryonic age. When this fetus was developing, initially this bladder was connected to the yolk sac through this urachus. But afterwards, as the development proceeded, all the organs are formed properly. So now we have got a completely closed bladder here. So we have got no use of this urachus left. So this urachus, it degenerates, and so we call it median ligament. Okay, it reaches up to the umbilicus because initially it was opening through the umbilicus in the yolk sac. Clear? Now, one is the posterior ligament, which has to go backwards from the base. So that is the posterior ligament. Then we will have lateral. So lateral ligament are going to connect both the lateral borders to the pelvic fascia, because this is lying in the pelvis. These are the pelvic organs because it is in the pelvis. So it is connected to the pelvic fascia. Now, in males we also have prostate here. So the prostate will also have to be held together by some ligament. So one is antero-pubo-prostatic ligament. One is a little sideways, so it is comparatively, compared to this one medial, we've got this lateral. So lateral pubo-prostatic ligament. So lateral is going to be connected to the pelvic fascia, and the medial is going to be connected to the pubic bone. And this bladder neck, it is going to be related to everything which is around. So see, it is anteriorly, pubic symphysis is there, and from the pubic symphysis we had two rami of pubis, isn't it? Superior ramus, inferior ramus, and between both the ramus there was an opening called obturator foramen, and from inside it was lined by obturator internus. So this is going to be related to obturator internus on the side and levator ani. Levator ani is the largest muscle which forms the maximum portion of pelvic diaphragm. Why pelvic diaphragm? There was one diaphragm that we have already studied, that was thoraco-abdominal diaphragm, which separated the thoracic organs from the abdominal organs, but also had openings for letting them pass. Otherwise there will be complete obstruction. So openings have to be there, but still a support has to be there so that nothing descends or nothing ascends. Similarly here you can see this is the pubic symphysis, then on the side there is other bone, but in the inferior portion there is no bony support, because we have to give space for this urethra to pass, we have to give space for vagina to pass, and vagina is required for the childbirth. Then we have to let this rectum and then anal canal. So 3 openings in the females and 2 openings in the male have to be allowed. So the inferior portion of the pelvis is not having any bone. So that has to be supported. All these organs have to be supported by a diaphragm, and that's called pelvic diaphragm. So levator ani is one of the largest muscle which is forming the pelvic diaphragm. So it's related to that. Now I think you have understood this. Now in the applied anatomy, one that I will say is what I said in the beginning, atonic bladder. When the bladder had lost its tone, the nerve supply, it will go on increasing in size. Then there was obstruction of bladder. Obstruction can be because of prostatic enlargement, it can be because of carcinoma of prostate, it can be carcinoma of bladder itself, it can be calculi also, renal calculi. So all these can cause obstruction of bladder. Then there is one more embryo congenital anomaly called ectopia vesicae. In that, this anterior portion of bladder is not formed, and along with it this anterior abdominal wall is also not formed. That means below the umbilicus the anterior abdominal wall is not formed, anterior part of the bladder is also not formed, so we can directly see the trigone in that patient, and so the urine is continuously dribbling through the ureteric openings. That is ectopia vesicae. So I think you have understood about the bladder. Thank you.